Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
How healthcare is delivered in America is always changing, and the baby boomer generation is set to make a big impact on our healthcare system. As soon as 2030, 18% of our nation will be 65 years old or older. Today we will explore what that means for healthcare's future and what your options are if you are part of the baby boomer generation. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back. This morning we're talking with Leanne Holmes, Bureau Chief of the Quality Assurance Division with the Montana Department of Public Health and Human Services. Thank you for being here today, Leanne.
Sure.
Before we launch into our conversation, can you just start out by telling us a little bit about what you do and what your department does?
Sure. So I manage the Licensure Bureau, and my bureau licenses about 2,000 facilities in the state for child care, healthcare, and community residential programs.
Okay.
And we not only license, but we inspect those programs with a focus on protecting the health, safety, and welfare of vulnerable populations.
Okay, great. And we're talking about the baby boomer generation today. Can you help us out to just make sure we understand what is the baby boomer generation, and are there a lot of baby boomers out there?
Yes. So baby boomers, the baby boomer generation is anyone between that age group of the people that were born 1946 to 1964, and they make up a huge part of our population. In fact, there's 75 million baby boomers at this time in America, and in fact, every year for the next 20 years, it's estimated that 3 million baby boomers will reach retirement age.
Wow. And so why is this an important thing to discuss today? What impact will that number have on us as a country?
Right. So with so many older Americans entering the retirement age, it means big changes for not only the healthcare industry, but also the housing industry in the nation. Baby boomers have a longer life expectancy than previous generations. However, they have more chronic health conditions that are kind of straining the healthcare system. Hypertension, heart disease, high cholesterol, diabetes. So that just puts a greater burden on the healthcare system and programs like Medicaid and Medicare.
Okay, and so those are definitely some challenges. What would you say is the biggest challenge maybe that comes with this generation?
Well, I would say probably the healthcare challenges are the biggest, and particularly the nursing shortage in hospitals. There's often state-mandated nurse-to-patient ratios, and hospitals, they'll probably be impacted the earliest. The U.S. Bureau of Labor Statistics predicts that the demand for registered nurses is going to increase by 15% between 2016 and 2026. And for advanced practice registered nurses, or what we think of as nurse practitioners, that increase the demand is expected to increase by 31% in that same time period.
Okay. And are there issues other than that come with the nursing shortage?
Yeah, so the interesting thing is many nurses, many baby boomers are experienced nurses. And so they currently have, as they have aged and are entering kind of a retirement age, they're serving in leadership roles. And so that means many of our nurses will be in that retirement group, leaving the healthcare field with inexperienced nurses, and at a time when the demand is increasing for nurses, the workforce is going to be going down.
Okay, can you talk a little bit about what that might mean then when it comes to patient safety?
Well, anytime you have a nurse, any kind of workforce shortage, it impacts safety in, well, really any field,
Sure.
but particularly healthcare. So we have the people that we end up overburdening and overworking the people that we depend on the most to provide the care. So the other thing is new RNs. will not have the experience that older, more experienced RNs have that have been in the workforce for many, many years.
Okay, so we talked a little bit about the issue around health and healthcare. What are some of the other issues that baby boomers might be facing?
Well, as I said earlier, unfortunately, housing is also another challenge that many may face, particularly those older adults that are low income, because while housing costs have increased, income levels haven't particularly increased, particularly among the low income. Federal subsidized housing, there's that, but it can't meet the demand, or it's expected that it won't be able to meet the demand. And then there's also a decrease in skilled nursing facilities, really across the nation, but particularly in Montana.
Okay, can you talk a little bit more about that? What are we talking about when we say a decrease in skilled nursing facilities?
Yeah, so just in Montana in the last 3 years, 9 nursing homes have closed.
Wow.
Which, and no new nursing homes have been added, no nursing home beds. So, and it's kind of a trend across the country that there's a decrease in nursing homes, and not a lot of new construction. So, and nursing homes always are hit really hard by staff turnover.
Okay, so these are a lot of challenges. We're kind of getting a little bit bleak here, but just to, we're almost out of time. In a couple of sentences, can you talk about, give us a little bit of hope here. What's being done to help out with this crisis?
Yeah, so I think that the promising thing is there's lots of resources and programs. I think as a society, we know that this generation is aging, and so there has been a lot of work put into programs and community resources to meet that need.
Okay.
So I think things are going to be changing.
Okay, that's great. Well, let's take a quick pause here. We're going to take a break, but thank you for that information so far. Our conversation is just getting started. We'll be right back to talk about the positive changes that baby boomers are bringing to the healthcare world. We'll talk about that next. Please stay with us. Welcome back. Leanne Holmes is with us to continue our discussion on the impact of the baby boomer generation on healthcare and the healthcare system. So thanks for sticking around with us, Leanne. So we've been talking about many of the issues that have been facing the baby boomer generation. Let's now switch gears and focus a little bit more on the positive. Can you tell us what positive changes are being done to help support retirees?
Sure. So as we discussed, baby boomers have more multiple chronic health conditions, as we talked about. Obesity, heart disease, those kind of things that lead to the need for more complex health care. The positive aspect is that in anticipation of this, the healthcare field has been training people to rise to the occasion and focus on more preventative medicine. So this means that the intent of that is to have people live healthier, longer lives by taking care of themselves earlier and catching things sooner. So patients are encouraged to be more active in their daily life and become more engaged members of their healthcare team. And actually, baby boomers report feeling younger than their age, so it's a perfect time.
Great. Can you talk a little bit about what's being done to help diversify healthcare a little bit?
Yeah, so especially, I would say that the baby boomer generation, especially the younger ones, with the explosion of online and social media and everything, they're really engaging in those things. And one of the positive things is that there's lots of opportunities for them to engage in their healthcare decision making and be more involved through social media and online resources.
Great.
And then in addition to that, there's also been a move in the healthcare field toward telehealth, particularly in Montana. In a rural state like Montana, telehealth, or it's sometimes called telemedicine, is kind of a key point in reaching some of these baby boomers with preventative measures.
Okay, great. And so what is telehealth? Can you define that for us a little bit?
Yeah, so it's kind of like it sounds. Telehealth is using technology to communicate, to make decisions, to monitor healthcare. So you can use your laptop, your computer, your smartphone, your tablet, all these things that we all have to get access to different healthcare services. So there's several ways that telehealth can help. Remote access, so that you can access your personal health records. There's monitoring that can be done electronically through maybe monitoring your blood pressure, or even, so far as to monitoring pacemakers remotely. You can also access your healthcare providers. There was a time you and I couldn't email our doctor at one time, and now that's possible, and they respond, either them or the nurses. So.
And before the break, we talked a little bit about the nursing shortage and the impact that that's going to have, but what's being done to help alleviate that a little bit?
Right, so unfortunately there's no quick solution for the nursing shortage. In fact, there are lots of people that are interested, lots of students that are interested in going into nursing, and they're being turned away. Qualified applicants are being turned away from nursing schools because there are just not enough programs. So that's something that the nursing programs need to address. But in the meantime, I think healthcare providers are more than ever aware of burnout and how that impacts workers, and it can lead to premature retirement. So they're trying to reduce the burden on the existing nurses so they can keep them happy and healthy. And then there's also community resources and even telehealth, like we talked about, that can they're probably going to have to help fill in the gaps in the meantime.
Okay, so that all sounds pretty positive. Can you talk a little bit more about some of those positive things that are
Yeah, so one thing that I think is really positive in the nursing field is you do have these experienced nurses, and they have programs that bring in new nurses to work with the experienced nurses, so there's kind of an overlap, and then they're providing more opportunities for experienced nurses to help them stay. So they want these nurses to stay and help foster the new generation of nurses. So they'll offer different flexible hours or days, or maybe even some more educational positions, something that's a little different.
Great, and you mentioned earlier community resources. Can you expand on what's being done there to help out baby boomers?
Yeah, so communities really seem to be coming together. In Montana, we have the area agencies on aging, and so I would just encourage people to contact those. Every community is different, so there are, there's programs for transportation and social services, and just kind of more of a holistic community approach to, senior centers will have healthcare people come in, and so again, if anybody's interested, just contact the area agency on aging. That's great.
And we talked a little bit too about some of the housing issues. What's the positive there? What's being done to help out with that?
I think with regards to the housing, there are a lot of additions in that you see now, these communities that are cropping up, that you have, senior housing options. There's subsidy, although they aren't enough to meet the need. There's certainly subsidies available to help low-income seniors. There's these continuing care communities that provide different levels of care to seniors. So there's just a lot of options out there.
Okay, great. Well, we do have to stop and take another quick break, but coming up next, we're going to be talking about some senior living options. Stay tuned, we'll be right back. Welcome back. If you or your loved one is part of the baby boomer generation, you aren't alone in wondering about your future. Leanne with the Montana Department of Public Health and Human Services is still with us. We're going to keep talking about this baby boomer generation. So it seems like there are many options available for older adults to choose from, especially when it comes to living. You mentioned that right before the break. Is assisted living the same as communities for retirees or that 55 plus group?
No.
Okay.
So they may have some similarities, but typically the 55 plus or age restricted communities or senior housing apartments are geared for active adults who enjoy healthy, independent living. So most of those communities offer different amenities. Some offer transportation, some have gyms, some have, you know, they range in what they provide. And while some have healthcare services on site, they're not licensed facilities, and
Okay.
Senior apartments are kind of the same. You know, they may offer some services like transportation or bus pickups or things like that, but they're much different than assisted living.
Okay, so what does an assisted living facility offer? Can you talk a little bit about that then?
So assisted living is designed to provide the level of service that you need to stay as independent as possible. However, when you go into an assisted living facility, there's an assessment that's done, and that determines your level of need. And so everybody in assisted living generally needs some level of assistance, whether it's, you know, just help with medication management or just some help with bathing or just somebody to help provide security for them. Most are apartment style, so they're kind of similar to some of those other communities in that way. But there's also a lot of small home-like assisted livings that are licensed in the state of Montana, ranging from 4 beds to maybe 10, just kind of small home-like. And then we have some that have 200 and 300 beds. So
Wow.
they really range in what that assisted living facility looks like.
Comparing assisted living with nursing homes then, how are they alike or different?
Right, so typically, as I said, assisted living is just to provide the level of care that you need, and generally that's a minimal level of care. It's not, you know, full assistance with your activities of daily living or those kind of things. Nursing homes, on the other hand, are designed to provide skilled nursing care to those that require a higher level of care and require 24-hour skilled nursing on site. So they have doctors and nurses that guide the treatment programs and the medical monitoring. They have nurses and certified nurses assistants that work round the clock to help the, you know, bathing, feeding, dressing, grooming, those kind of things. And assisted living residents are generally more independent than that and don't require that level of skilled nursing, at least for long periods of time.
Okay. Are there other options when it comes to senior living?
Yeah, so I think I talked about this a little bit earlier. There's these continuing care retirement communities. So you may actually go into one of these communities as an independent in an independent apartment that is not licensed, or you don't receive any services. And then the next step would be a retirement. You know, you'd move to the retirement part where you have laundry and a meal and some housekeeping. And then as your needs change, there can be assisted living, and then some even have nursing homes that are attached. So as your level of care changes, you don't have the drastic move of moving to a complete separate place, maybe just a different place within the same community.
How does a person assess that then? Where do they start to determine which home is right for them?
Right, so if you don't know, it would be a good idea to get, if you don't really know what exactly your needs are, or a lot of times people underestimate their needs.
Sure.
So you would want to go maybe have an assessment by your doctor, or any assisted living facility has someone on staff that can do an assessment. And then you always want to consider the financial aspect. These things vary so greatly in cost, from just an apartment to having, a full assisted living slot, and then certainly a nursing home. But you'd want to visit a bunch of different facilities. You'd want to look online. You'd want to research. You could call the state. My office, we have an online web portal that shows the different facilities and different communities and what their track record is as far as deficient practices. And so you always want to get a clear picture of the cost and what kind of financial arrangements, because you don't want to move into some place and then not be able to afford it.
Sure.
Yeah.
And then once you determine which place might be right, or type of place might be right for you, if you go into that home or that facility, are there questions that you should be asking?
Sure. So you should always ask, I would say, for a copy of the contract. Every place has to have a contract for what they provide, what services they provide, and what the costs are, what the fees, what the limitations that are there. Can you participate in your own medical care? What kind of training and background checks are done on the staff? That's really important. And I think one thing that's really key is, what happens if my level of care changes? Do I have to move, or is this a place that I can stay?
Mm-hmm. And Leanna, you talked really briefly about the cost being important. We are just about out of time, but can you talk to that just a little bit more?
Sure. So assisted living, the average cost is about $3,500 to $4,000 a month for assisted living. Long-term care insurance does cover assisted living. Of course, you'd want to check with your policy, but there are some Medicaid funds available for assisted living slots, and the VA. And spouses usually get a discount on when they room together.
Okay. All right, great. Thank you so much for all your time and expertise. That's our show. Thank you so much for joining us today. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.